All right, and we are live. Hi, everybody, and welcome to our weekly wellness sessions for musicians. My name is Francesca Leo, and I am the chair of the Wellness Committee on the Puerto Rico Flute Symposium. I'm joined by my colleague, Jessica Kebby, who is the director of the Collaborative Piano Institute, the Puerto Rico Collaborative Piano Institute. And today we are so excited to present our guest, Heather Mogielnicki. She is an occupational therapist, a certified hand therapist, and a psychic energy healer. Prior to her life as a therapist, Heather was a professional flutist who sustained career-ending injuries that led her to the path of becoming a therapist. She has specialized in working with injuries in the upper extremity for the last 22 years, and she's also started her own business called Healing Hands Therapy, and the website is in the description if you're interested in checking out more of her work. She was commissioned to create a semester's course on health and wellness for musicians for Western Connecticut State University's music majors. She has lectured to various music groups, doctors, and therapists across the country and has created an online course for musicians. She works with musicians internationally in finding balance physically, emotionally, and energetically to bring their body, music, and spirit into alignment. So today, Heather will be joining us to discuss common things that cause injuries among flutists and all musicians. We'll be talking about some of the most common injuries, what to do if you find yourself with one, and also some healthy habits to prevent them in the first place. So as a reminder, we always offer MP3 or MP4 versions of these videos. If you would like to share them with your students, if you're a teacher, go ahead and send us an email to wellness@prflutesymposium.org. We also have an archive of all of these sessions on the Puerto Rico Flute Symposium YouTube channel, as well as diazdelmoralfoundation.org. So at this time, I'm really excited to pass it over to Heather.
Thank you. Thank you so much for having me. I'm going to share my screen, and hopefully this is going to work. So, yeah, okay, I got the thumbs up from Francesca. Awesome. The technology stuff is definitely not my thing. So, I want to thank you guys for having me. I think that what you are doing is absolutely amazing. All these topics on wellness for musicians is such an important thing. I'm just going to move my camera for a second so I can sort of see. And none of this stuff existed when I was a flute player. So I think that's an incredible thing, and you guys are doing an amazing job. So everybody should be really thankful that you guys have stepped up and are doing what you're doing, because more people need to do that. So I'm going to talk a little bit about why my story is what you can take away from my story. So I was, obviously, Francesca said, I was a professional flutist. From the moment I was in 5th grade and I picked up that silver tube, I knew that I wanted to be a flute player. That's all I ever wanted to do, nothing else. So I never faltered when I went to, high school. I always knew that where I was going to go. I wanted to go to music school, and I did. And then I was preparing to move my life across country to do studio work, which was my dream. And I ended up with a whole bunch of injuries in my entire right side. So nobody ever talked to me throughout school, in high school, in college, about wellness for musicians, about what we can do to keep our bodies healthy, about our emotional state, about our energetic state, about our physical bodies, about our practice habits, about our posture away from our instrument, our posture at our instrument. Nobody ever talked about any of these things to me. And I don't think that happens a lot. I think it's happening more and more these days, but I think we need to be doing a better job educating people on this, because it is so important. And the bottom line is that 80 to 90% of musicians will end up with an injury. And Francesca and I had a conversation about this because she's done some amazing research, and your numbers were pretty much the same. I think they were a little bit less, but your pool might have been a little bit smaller. And this number is taken from probably 25 years ago. So in this 25, 30-year period, nothing has changed. The numbers and the stats are still way too high. And it does not have to be that way. It just doesn't have to be that way. So I think that's the most important thing. So I think we need to first think about our bodies. All right, so there's lots of things to look at. And when I look at things, I look at the physical things that are going on structurally within a person's body. I look at what's going on environmentally, how people play at their instruments. I look at other things that we're doing in our life that are contributing factors. And then I also look at the energetic aspect of things, that mind, body, spirit connection, that soul connection. Where are we out of alignment? Because when we are out of alignment energetically, that's when physiological stuff also happens. So I know you guys have had a lot of talks about mindfulness and all that stuff recently, so I'm not going to dive too much into that. But it's really, really important when it comes to those physiological systems, okay? So what plays your instrument? Your body, right? You cannot play your instrument without your body working properly. You just can't, all right? And if you think about all the different things that have to occur inside your body to allow you to play your instrument at the level that you play, it's absolutely unbelievable. I'm not going to go into all that because in the online course that I have, I go into all that so that you can kind of have an understanding of, you know, the nervous system and all these different systems that come together to create this. But I just fell in love with this picture, and I wish that the guy was holding a flute instead of a saxophone. But it's, if you just look at the muscle stuff that has to happen without even looking at nerves and the respiratory aspect and all those things to come together to be able to play in tune, to be able to play musically, to be able to coordinate our fingers, to be able to move our muscles in the correct posture for our embouchures. All these different things have to come together. The signals from our brain down to our hands. We have to get the feedback from our hands back up to our brain. All that needs to work really, really, really well in order for us to do what we do as musicians. So the more we appreciate our bodies, the more we're going to take care of our bodies, okay? So what causes injuries in musicians, especially flutists, since that's what we're talking about today? One primary thing is posture. And everybody talks about posture, right? Posture, 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 posture. You hear it till you're blue in the face. But just sort of take a look at this picture and kind of assess which one you are. Like, which one are you? Like, if you look in the mirror or have somebody look at you and be like, oh, you're this one, you're this one, you're that one. Technically, in a perfect world, we're supposed to be the one all the way on the right, which is the good posture, where our shoulder is above our ears above our shoulder, which is above our hip, which is above our knee, which is above our ankle. And that's in a static posture. So that's just when we're standing. We are not static people, we're constantly moving. But this is the basis for support, all right? This is the basis for support, all right? So why do we really need to care about posture, all right? When our posture is off, it sets us up for injury, okay? Good posture places the least amount of strain on our muscles, our tendons, our ligaments, our nerves, our nervous system, and our joints, okay? It helps prevent muscle fatigue, okay? It allows us to use less energy. When we have good posture, we use less energy, all right? It takes more energy for us to be in a slouch, junky posture than it does for us to be in a good posture, as long as we have worked the muscles and balanced the muscles to be in that good posture. It helps our circulation. It helps our digestion. It helps our core stabilization, all right? It gives us confidence, right? If we have good posture, it gives us confidence. It allows for better joint flexibility, and then we have to move our joints in all sorts of crazy postures in order to play our instruments, right? It allows us to breathe better. And as wind players, this is key, right? Breath work is so, so, so important. And there's a whole system of respiratory muscles that are so important. And that really is interrelated with our posture, okay? So what is the vibe that your posture gives off? Because that's the other thing we have to think about, right? And this is kind of where our energy comes into play as well, all right? So if we're kind of like slouched over like that first lady, like that's sort of like, oh, whatever, we don't care. Our energy is low, right? Whereas the lady that's standing upright, her energy is confident. She's engaged, right? That's an engaged person. The poor dog in the middle looks scared to death, right? He looks so frightened. Like, is that what we look like when we go out on stage sometimes when we perform? Like, maybe, right? The lady on the left, she just looks like she's holding on for dear life, trying to play her instrument, trying to figure out what chord to play, right? There's a lot of tension there, right? And then the military guys on the right are super confident, super confident. So what energy is your posture giving off? Because that energy that is giving off from you also plays a role in how you feel physically. Okay. The more kind of inward and insecure, and the more our posture is rounded and stuff, it really sets us up for injuries, especially in our, in our joints and everything, in our muscle tendon units. So we just have to be careful with that. So I just thought these pictures were kind of funny, right? If anybody's got, for the music students that are lugging all their stuff around, thank God flutes are small, but well, unless you're dealing with a bass flute or an alto flute, that's a whole nother story, but still, all right? And then just think about your posture at your computer too, that's another thing. So poor posture in general sets us up for injury. Poor posture at our instruments sets us up for injury specifically, all right? I love this banjo guy on the left. I just thought he was absolutely hysterical. So, and obviously the lady on the right, she's not a flute player, but you can sort of see, that posture is not going to lend things very well for her shoulders all the way forward. If she continues to play like that, she's going to end up with issues in her shoulder, her forearm smashed into her instrument over here. There's clearly a lot of tension in her fingers. So we look at all this, her head is super forward, it puts a lot of strain on the muscles in the back of the neck, all of that, okay? The other thing that causes injuries is we have happy and sad joint positions in our body. Our joints like certain positions and they don't like other positions. And this is something that we don't really necessarily think about when we learn how to play our instruments. Nobody really kind of tells us that. We're just trying to figure out how to get a sound out when we first learn, right? And then, nobody really, our teachers don't know about anatomy and physiology and kinesthetics and all that stuff. That's just not their thing. So why would they be able to teach us this, right? It's not something that, I didn't know anything about it until I went to school to be a therapist. So, and then spent years studying anatomy and physiology. So there's very specific cranky joint positions. And in the flute, there's a lot of them. So every instrument has specific ones that, that they have issues with. And for flute specifically, it can be the thumb, right? So I'd be curious if people, can you guys see comments on the Facebook Live?
Yeah, we can.
So I'd be curious to see what people struggle with in terms of what body parts people struggle with, right? So if you guys get feedback, if you could let me know, and then I can kind of sort of speak specifically to that. So this was obviously me, and these were the things that I did, all right? So my thumb position on the right-hand side is really bad, okay? And if you just take your thumb and you rest it kind of down at your side, take your hand and rest it down at your side, and watch where your thumb falls. Your thumb naturally falls underneath your index finger, all right? So that's the happy joint position for the thumb, all right? It's under the index finger. And then when you take your thumb and you pull it over, say under your middle finger, how does it feel? Not so great, right? It doesn't feel good. And then you take it and you extend it like that, as if we're holding onto the instrument. And how does it feel? It feels junky, right? It does not feel good. So this is one thing that we always want to try to get our thumb into this more relaxed, better position, all right? And it's not an easy thing to do because we're trying to stabilize the instrument, right? And we're trying to stabilize the instrument essentially with our thumbs and our lip, our chin, which is not easy. So it's a matter of making sure that we can have this and be in as much of a happy position as possible, all right? And it's the same thing with our shoulders and our necks. Our neck positions are happiest in this straight position. They're not happy when they're turned like this for a long period of time, or when they're turned like this for a long period of time. They don't like that. They go into those positions easily, but as musicians, we tend to stay in one position for a long period of time. So when we're hanging out in this position for a while, it creates these muscle imbalances, and those muscle imbalances lead to injuries, okay? The other thing that I did is I hyperextended my little finger on my E flat key. And this is the thing that actually has prevented me from going back into music, is come to find out, which I didn't know until I became a therapist, is that I'm actually missing the tendon that bends this middle joint. But I overstretched these ligaments that are on either side of that middle joint there because I was constantly in this hyperextension. All right. So being in bad positions, and this is not a happy joint position, this is an unhappy joint position. In that position for years and years and years and years and years created problems for me. Okay. The other thing that I did is I always played standing up. I would always practice standing up. Whenever I performed, I'd sit if it wasn't a recital, but I always leaned into my left hip. So I want you to think about what static postures are you in. I always leaned into my left hip. So I created a leg length discrepancy. So my pants were shorter on one side and longer on the other side because of how I played my flute. All right. And it sounds insane, but our tissues adapt. All right. Our tissues will adapt to the postures and positions that we put them in for extended periods of time. There's lots of medical studies on this. It's called total end range time. And I won't bore you with the scientific details of it because I'll put you to sleep. But it's very, very interesting. And it's amazing how quickly they adapt and how slow they are to readapt. Okay. So that's always why it's important to be in the best position that we can be from the start. Okay. So this is a patient of mine. I have consent to actually use this video. I don't know if you'll be able to hear it, but you don't need to hear it. I just want you to watch certain things with her. So this is a patient that came to me with bilateral hand pain and numbness and tingling. And great player. And I just want you to watch, if you look at, happy and sad joint position. So if you just take your arms and you bring them up high so that they're parallel to the floor, right? How do your shoulders feel? A little tired, right? I can tell you my right shoulder feels like, whoa, right? And it's like, oh, I need to come down a little bit. Like this is just too high, all right? And then if you take your head and you go back a little bit, doesn't feel so good either, right? So if we bring our shoulders down a little bit, it's much more comfortable, right? It's much more comfortable. When we come up higher, we're actually impinging that shoulder joint a bit, all right? And we're kind of squishing some of the muscles in the shoulder. So that's why posture and positioning at our instrument make a difference, because if we're in this position for a long period of time, we're not only going to cause problems at the shoulder potentially, but it actually can cause problems down into our hands. So if you just watch her play, I'll turn that down. So her arms are pretty high. Her head is pretty far turned to the right. Her thumb's not too bad. It's right under her trill key, which isn't horrible. Right? It was nowhere near as bad as mine was. Her right arm is high. I want you to watch her eyes though now. See how her eyes go up, and as her eyes go up, her head goes up. And when her head goes up, it changes everything. Okay? And then as soon as your head goes backwards, you kind of cut off your airway a little bit too, right? So again, she came with issues in her hands. It was really more of a postural issue that we had to deal with. We had to lower her arms down, bring her head over a little bit more so it wasn't turned quite so much, to try and get her symptoms to go away. All right. So again, posture, happy joint positions. What are we doing? And this is, she'd been playing this way for a long time. This is just how she learned, right? We're not doing any of this on purpose. Like, this is just how we learn. These are our habits that we get into. And then sometimes we just need that extra set of eyes to be like, hey, what am I doing wrong? Like, what are things that are potentially causing problems at some point in time in my career? So, so this is a clarinet player, but I just wanted to show it because this goes back into the whole head positioning. So again, this happens with flute players too, where we bring our head too far forward when we play. So our head comes really far forward. So what happens is our ear ends up being way above and in front of our shoulder. And clearly I can't take a picture with a pen and take a picture at the same time. So I had to draw an arrow. That just wasn't working. I don't know what I was thinking. My pen was way too far ahead. But you can see how far forward his head is compared to his shoulder. So if you go with that positioning, ear above your shoulder, he's pretty far forward. And if you just think about it, when you bring your head forward, what happens to your throat, right? It sort of feels like things get cut off. But if you bring it too far back, it gets cut off too. That does, like, there's that happy medium in there, right? Okay. So this is a flute player that came to me just because she wanted to make sure she wasn't, she wanted to set herself up for the future to make sure that nothing was going to, we could prevent as much as we possibly could. So as you can see, her thumb is essentially underneath her E key, all right? And it's got this wonderful curve here in this joint, and then it's kind of coming too far in right over here. So she was a little bit hypermobile here. So I put her in a splint. This was really more for biofeedback to keep this tip straight. And when she keeps her tip straight, her thumb opens up, and then she's much more able to we got her so that she was underneath her trill key instead, which was a happier position than being all the way under the E key. And she was able to eventually get rid of the splint because she was able to retrain the tip of the thumb to not go into this crazy hyperextension here, okay? So this is, again, this one picture on the left is an unhappy joint position, all right? And then we're trying to get her into a happier joint position over here. The other thing that causes injuries is if you happen to be really flexy bendy, all right? So this is a flute player. And this is her holding her thumb, okay? She's naturally got really lax ligaments, all right? When you have really lax ligaments, especially in the hand, there's no muscle bellies in the hand to support the joints like there is in the shoulder or the hip, those kinds of things. There's no muscle bellies that cross the joints in the hand, only tendons and ligaments. So what happens is when you have this hypermobility, it's really hard to stabilize. And your little tiny muscles that actually are in your hand, they don't cross the joints, they're in the hand, they end up overworking. And then the muscles in your forearm end up overworking because of you're so flexy bendy. So what do? You have to kind of find solutions for that. You have to, if it's not in the hand, you have to do very specific exercises. And if it is in the hand, then there's these wonderful splints called silver ring splints. So you can see what a huge difference it made for her. Huge. So she plays with these as well. I don't know why I don't have a picture of her with her flute, but I don't. So. So the other thing that causes injuries, and this is where we kind of get into our mindset issue, is for every thought and feeling that we have, there is a physiological response to that thought and feeling. So if you have a feeling of, oh, God, I'm never going to be able to play that lick, I'm never going to be able to play that piece, or my teacher said I'm never going to be able to play that piece, so I'm not good enough for that piece, or how does that make you feel? That brings your energy down, right? There's a physiological response to that. You feel junky, right? If you're, walking and you see something that scares you, like a snake or a bear or something like that, what happens? Your heart rate goes up, right? Your blood pressure goes up. There's a physiological response to that. If you're nervous for a performance, the physiological response is that your hands get a little clammy. You might shake a little bit. There's always a physiological response to a thought and feeling that we have. So we have to kind of figure out what those thoughts and feelings are and what they're doing to us physically. And a lot of these things can be subconscious too, all right? A lot of the thoughts and feelings that we have that lead us to have injuries can be subconscious. I had a patient, she's not a musician, but it just goes to kind of describe how powerful our minds are and the subconscious energy that we hold on to. She was training to be an Olympic gymnast. She was 13, and she'd get off the bar and her hands would be clawed like this, and she'd have incredible pain in her hands and in her forearms. So the trainers are massaging her forearms and stretching her and doing all this stuff, and she wasn't getting any better. Her mom brought her in, put the bar in the doorway of my clinic. Within 30 seconds, she was doing this. I just got this close to her and she jumped back and was in pain. I didn't touch her. This was not a physiological problem that she was having. It was there was a subconscious emotional thing that she was holding on to. So I sat her down and I said, what are you holding on to? She's 13, so she's like, well, I don't know, nothing. So we just talked a little bit more, and all of a sudden she started crying. She just started crying, and she had lost someone who was like a father figure to her. Her mom's ex-fiance was like her father, had died suddenly 5 years ago. Her mom had just started dating. The dating was the trigger for these emotions to come up. She didn't know how to process them, so they came out physiologically. Okay, so there was nothing wrong with her from a anatomical standpoint. It was just she was holding on to all of this energy that was creating this physiological symptom, and the symptom was real. It's not like it wasn't real. Like doctors will say, oh, it's all in your head, and that really drives me crazy, because it's not all in your head. There's a reason why we have the things that we have. We have to figure out why they're there. So intuitively, I knew what was going on with her, but we had to kind of work through, and she had to come to the realization herself. Her symptoms never came back after that. They never came back. I never touched her. Like, we just talked, like we just uncovered what the issue was. So that's how incredibly powerful our mind, body, spirit connection can be. But subconsciously, we may not be aware of those things, right? Anxiety can cause injuries. That's a huge one. All right. Holding on to that negative energy, past or current trauma. Like she had this past trauma, and negative mindsets. I had a clarinet player who was a phenomenal clarinet player, and he had a couple of physiological things going on, but there was just one thing I was like, something's going on. So I asked him the question. I was like, what are you holding on to? And it's like my standard question now. And he's like, I don't know. So a week later, he calls me back and he's like, I figured it out. I'm like, okay, good. What did you figure out? He's like, I don't want to be a professional clarinet player. I'm like, okay, well, hold on. I was like, just step back for a second. But he's like, I said, how do you feel? He said, all of my symptoms are gone. I said, all your symptoms are gone. I was like, okay. So we worked through a lot of that. We talked a lot. I had him talk to his teacher, his parent, all this stuff. And he keeps texting me. This has been like a year now. And he's like, I just want you to know, I'm so happy. I feel so good. He's doing something completely different that's much more aligned with his soul. He still plays, but it's not, he didn't want it to be his job, right? So that's one of the things we always have to look into and figure out what's going on. So staying in one position for too long, I kind of talked about this already in terms of how I was always kind of leaning into my hip, but you can see what happens to your spine and what can happen to your muscles when you kind of go into one position. So if one shoulder is higher than the other and you stay like that for a while, you're going to get tissue changes. So what's going to happen is these muscles on the left are going to lengthen and the muscles on the right here are going to shorten, not to mention all the changes that are going to happen down through here. And our shoulders are the base of support for everything in our hand and all the way down. All right. So you always have to look up and down the chain. Just because you have symptoms in your hand does not mean that they're not coming from your shoulder, and vice versa. Like it can radiate up and it can radiate down. Okay. Muscle tension. Oy, the dreaded muscle tension. All right. So this is one thing, my biggest tip for this is to scan your body on like an hourly basis and see where you're holding muscle tension. Muscle tension is this constant contraction of those muscles. When we're constantly contracting muscles, we're constantly firing the nerve that activates the muscle, and it gets exhausted. And then it leads to tissue trauma and it leads to injury, all right? So half the time we don't even realize that we're contracting these muscles, all right? We just posture things. When I would go for a run for years, I would run and I would hitchhike. My thumb would be in this position. There's no reason, and maybe I was subconsciously looking for a ride. I don't know, because I didn't want to run. But I would start getting pain in through this area. I'm like, why am I getting pain in through here? I finally realized that when I run, and I run long distances, that I was in this position. So I constantly had to remind myself, bring your thumb down. And then 30 seconds later, my thumb would be back up. I'd have to remind myself, bring my thumb down. It was this constant, I guess it took away the torture of not being able to breathe while I'm running, because I was focusing on what position my stupid thumb was in. But think about that. Scan your body throughout the day and be like, where am I guarding? Where is the muscle tension in me? Where am I holding on to things? The other day I sat down to meditate and I thought I was all relaxed. And I was like, okay, I'm all relaxed. And then I just scanned my body like 5 minutes into meditation. I realized that my hands were clenched. I'm like, well, that's not relaxed. Like that's not helping me, So just be aware, and I'm aware of all this stuff, but I still do it. Like we're just human. This is what happens. Life affects us, and then it comes out into our bodies. So we want to eliminate as much of these muscle tension areas that we have, because whenever we have tension, it can lead to injury. And then we don't play as well when we have tension. When we're tight and we're tense, we can't play as well. Our fingers don't work as well. Our breath doesn't work as well. Our sound isn't as good. Our intonation isn't as good. All that stuff is affected. Okay. So do you have a death grip on your instrument when you're playing? All right. That's the one thing to think about too. Are you holding on for dear life? All right. Where are you holding tension when you're playing, not just when you're out and about doing life? All right. So where you posture and hold tension at your instrument, you may be doing that during your normal day, or you may be holding it in other places as well. Okay. The big thing too is we tend to have extra tension if we don't feel like our instrument is stable on our body. Okay. So if we don't feel like our instrument is stable, now Jessica, you don't have to worry so much because you're piano, so it's stable on the ground. But you have to feel like you could move and be stable at it, and also have that fluidity of movement. But every instrument has its issues, and flute is a little bit challenging because it's this skinny tube that we're trying to balance on our chin, blow into this tiny little hole, right? And get out a sound and move our fingers and do all the stuff at the same time. It's stupid, really, when you think about it, right? How do we actually do this? And it's amazing that people play as beautifully as they do, given what we're tasked to do, right? But it creates tension, all right? It creates tension. And the biggest issue is to figure out why there's the tension there in the first place, right? And that gets back to kind of digging into, always ask yourself the question of, what is my body trying to tell me? What is it trying to tell me? So if you have tension, don't just be like, okay, I have tension. Well, why do I have tension? Is there a reason I have tension? Where does that tension come from? Does it belong to me, or did I take it on from somebody else because it's a limiting belief from somebody else that I've taken on that's now kind of created this feeling in myself? It's like when we went to the grocery store in the beginning of COVID, how horrible did that feel, right? You come out of the grocery store and you'd be like, your whole nervous system was shot, right? All these things contribute to our body's tension. And when we get into these posturing techniques that we do, and these habits, I should say, it becomes a muscle memory, and we automatically go into that position. Just like I was saying, when I was hitchhiking and running, I had to constantly retrain my brain that I don't need to hitchhike. It's like when we learn the lick the wrong way, and it takes twice as long to learn it the correct way, right? It's because we have to erase that motor pathway and we have to create a new habit. It's the same thing with eliminating tension in our muscles. We have to erase the old motor pathway and create a new one that's more relaxed and calming. All right. The other thing that causes injuries is not warming up physically before you play. So I ask all of my patients, what do you do for a warm up? And it's always scales and arpeggios, long tones, certain things. It's never a physical warm up. Or if it is a physical warm up, it's things like, oh, I do this, or I do this, or that kind of thing, which is more of a static stretching thing. It's really important to do a dynamic stretching routine before you play your instrument. You need to warm up your body. You never see an athlete go out to play their sport without doing a dynamic stretching routine before they go and play. Musicians need to think of themselves as elite athletes, right? And treat our bodies the same way that elite athletes treat their bodies, because there is no difference. They're playing a sport that's different than playing an instrument, but the requirements are so intense as for musicians that why aren't we warming up our bodies, right? So there's very specific things to do. I created a dynamic warm-up stretch that I give to all my patients, and it makes such a huge difference. I wish I had known about it years ago, because it sets the tone for your practice time too. Okay. What other things lead to injury? So not drinking enough fluid, obviously we kind of all know that. Not breathing properly, right? A quick increase or jump in our playing time. Who's guilty of this? Probably everybody, right? Yeah, I know I did for sure. I have I can think of two very specific patients, three right now, that during COVID went from like 2 hours to 6 to 8 hours. And they have some serious problems. And it takes twice as long to recover from those injuries than it does other injuries. They're really, really, really stubborn. The other thing is not taking breaks. All right. So I would go to my practice room and play for 2 hours straight and not take a break. That is the worst thing that we can do. Playing for too long can just lead to injuries, and it's not good for our brains either. We don't get as much done. We think we do. We think, oh, I'm going to get so much done. I got 2 hours. I'm going to get it all done. Even if we just take a 2 to 3 minute break to get out of the deforming position that our instrument puts us in. So put the instrument down, open up your posture, get a drink of water, go for a quick walk up and down the hall, and come back and play. It doesn't have to be a long break. It doesn't have to be long. All right. And then computer. Right, everybody's at computers these days. I don't think there's anybody that's not at a computer these days. So poor setup at our computer can really lead to problems. All right, I have a patient now who's got thumb pain because she's on her phone too much. All right, and she's spreading her thumb. She's putting her thumb in a really junky joint position as she's holding on to her phone. So her thumb's not in a happy joint position. So her thumb hurts. Okay. So we're going to go into quick joint positions, and I'm probably going too long, right? What time is it? I've already been a half an hour. I got to hurry up. So types of injuries. We have acute injuries, which are like the thing when we first notice the symptoms, okay? This is the best time to do something about it. And we all typically say, I'll wait and I'll see. I'll wait and I'll see what happens, right? You can wait and see for a couple weeks, but anything after that, once you get to the 3-month period, you're into a chronic injury state. Chronic injuries are much harder to treat, much harder to treat. The pain fibers keep firing over and over and over and over again. It just means that the underlying injury is not actually healed. We keep overstressing those muscles and damage occurs, all right? We actually get cellular changes with chronic injuries, okay? Our systems are really, really highly trainable, but it's good, but it's also bad, okay? And then it can just, I already said that, it leads to chronic changes. And then it leads to anxiety, depression. Most people with chronic pain have anxiety, depression, fear, all of those things, all right? So a strain is, I'm not going to go too deep into these because I want to talk about more specific diagnoses, but a strain is more of an injury to a muscle or tendon unit. You'll hear the difference between strain and sprain. Strain is an injury to the muscle tendon unit, and a tendon goes muscle to bone, okay? And then a sprain is an injury to the ligament, and ligament is bone to bone, okay? Symptoms are very similar, so they get mixed up very easily, okay? So common injuries, tennis elbow. Anybody ever have elbow pain? Has that been one of the things that people have talked about? You have elbow, yeah.
Yeah, I've had elbow pain in the past.
Oh, hold on, I can't hear you, hold on.
Can you hear me now?
I just turned my volume down when the flute player was playing. What did you say?
Oh, can you hear me?
Yeah.
So I definitely have elbow pain. It's mostly in my shoulder, but sometimes I do get it in my elbow, yeah.
Yeah, so elbow pain is, again, and this is one of the things, when I have a patient who has elbow pain, I always look at the shoulder, I always look at posture, and I always look at the shoulder blade, because there's a couple muscles back there that if they're really in spasm, they pull on everything down into the elbow and cause problems down into the elbow. So though the problem can be at the elbow, and it often is, it can also be coming from your shoulder, right? So tennis elbow is a very common thing. It's called lateral epicondylitis in the medical world. It's not an inflammatory condition though, okay? The itis makes you think it's inflammatory. They just never changed it. It's actually, you get little micro trauma tears within the tendon that inserts onto the bone. So these are just all, so this is an anatomy lesson quick. These are all the muscles that extend your wrists and your fingers. Okay, so if you think about that when you're playing your instrument, all these guys are working to extend your fingers and your wrist. It's crazy. And they all, most of them start up on one spot at the elbow, all right? So that's one of the very common diagnoses that you see is somebody with what's called a tennis elbow, all right? Again, if you get diagnosed with tennis elbow though, you wanna make sure there's other things that it can be. So if you go to your primary care physician, he may just say, oh, you have tennis elbow. There's a few other things that this can actually be And it's important to differentiate exactly what it is. That's the important thing. All right. Common symptoms with tennis elbow are pain in the elbow, difficulty lifting, difficulty opening jars, holding onto things, carrying the groceries, anything with your arm outstretched will hurt like heck, for sure. All right. Common treatments for are these lovely little elbow braces. Some people will put you in a wrist splint. Some people will tell you to rest. The doctors always like to tell you to rest. Just don't play. Just don't play. That's like, you can't do that to a musician. There's always a way to be at your instrument, no matter what injury you have in some way, shape, or form, unless you're into this crazy cast that just does not allow you to hold your instrument. Medications is another one that people typically give, and then injections is another one that people typically, that the medical world kind of goes by. From a therapy world, I always look at energetically the whole body system. So, we do some stretches. You want to be really careful when you look up things online, because one stretch may not be good for you, even though it's a typical tennis elbow stretch. It may actually not be good for you. It may not be the best position for you. And there's all sorts of different manual treatment, activity adaptation, all that kind of thing. Thumb pain. We've already kind of talked about thumb pain, right? Especially with flute players, clarinet players, saxophone players, the darn trying to stabilize the instruments, okay? These are just some different things that we like to do. There's different types of splints, there's different types of thumb posts. Do a lot of people use the thumb ports and the bow peps and stuff like that?
Yeah, I've noticed more and more, and the Prima thumb rests have been popular lately. Those like give a little bit more of height to the bottom of the flute. I don't know if you're familiar with those, but
I haven't seen that. No, I'll have to look it up. Yeah, I'll have to look it up and see. I'll add that to my list.
yeah, they're helpful. Yeah.
Wrist pain. All right, so this is like going into no man's land. Wrist pain can be lots and lots and lots of different things. So it's important that if you're having pain in your wrist, don't ignore it. You need to go have something done to it. My neighbor just had texted me. He's like, "Oh, I fell on my wrist like 3 weeks ago, and it still hurts. My X-ray was negative." And I said to him, I said, "Well, something's wrong if you're still having pain." I said, "You need to go back. There's something going on in there." And he texted me, and he did. He had what's called an avulsion fracture. So one of these little ligaments on his wrist had pulled off a piece of the bone. Okay, but they missed it. The urgent care center missed it. So it's, there's so many different things that wrist pain can be, because there are so many little different structures in here that you really want to make sure that you have a specialist look at you to make sure what's going on. Okay. These are just a whole list of different types of diagnoses. I don't know if anybody's had any of these. If you have, go ahead and comment and let me know, and I can kind of chat about some of them. But, a lot of them are, the different tendonitis types of things. Deeper veins is probably a common one with flute players, because what that is it's pain in this little area in through here. Right, and it's a swelling of it's kind of like a sleeping bag. Two tendons travel through that sleeping bag. You get inflammation that's in there. And whenever there's inflammation in there in a small area, it doesn't get happy. This is a very stubborn one to treat, that's for sure. It is treatable, but it's very stubborn. Shoulder pain is, again, another one of those things that it can be so many different things. It can be so many different things. Some of the common ones are rotator cuff injuries. I'm sure people have heard of that. Biceps tendonitis is another one that's pain in front of the shoulder. I'm pointing to my shoulder, but you probably can't see it. Impingement syndrome. So if our arm is up in this position for too long and we end up impinging one of the muscles that comes underneath, that's really, really common as well. All right. Cubital tunnel, numbness and tingling in your ring finger and little finger. Anybody ever have that? That was one of my big issues when I had my injuries. And when you hit your funny bone, it's not your funny bone, it's actually your ulnar nerve. It travels right through here. It's really close to the surface. And if you bang it, it brings you to your knees. And if that nerve gets irritated in this area, it can give you numbness and tingling into your ring and half of your ring finger and your little finger. All right. So those are the common symptoms in there. So typically, this is all very similar to carpal tunnel. I'm going to go over that too. I'm just going to kind of speed through. This is a typical splint that we make for cubital tunnel, because anytime you have your elbow bent, it irritates your nerve and it ends up pulling and stretching that nerve, which ends up decreasing blood flow to the area and increases your swelling, increases your symptoms. Okay. Carpal tunnel, everybody's heard of, because everybody talks about carpal tunnel. The key with carpal tunnel, and I just did a video on carpal tunnel, because it's not always carpal tunnel. Your nerves start up in your neck, they come all the way down into your hand, and they can get compressed anywhere along that pathway. And again, they get compressed because of poor posture. They get compressed because we're not in a good position at our instrument. They get compressed because we're leaning on them. We're doing this all the time and overstretching them, or we're doing this all the time and compressing them. There's all sorts of reasons why the nerves can get mad. But carpal tunnel is very specific in terms of, if you have carpal tunnel, you have compression of the median nerve in this area, and you get numbness and tingling to your thumb, index, middle, and half of your ring on the palmar side. Okay, that's the biggest thing. It's never anything on the back of the hand. It's always on the front of the hand, and it can also get compressed in the forearm. All right, so you'll see some people kind of digging and digging and digging up in here. If your nerve is irritated in your forearm, if you're digging and digging and digging, you're going to actually irritate it, okay, rather than make it better. So again, it's really important to figure out where on that pathway of that nerve is it getting compressed. Common symptoms, I already kind of talked about that. Thoracic outlet syndrome, I don't know if anybody's heard about this, but this is you get nerve symptoms and vascular symptoms with this. So it's a compression. This is your brachial plexus. So just think about this for a second. These are the nerves that are coming out of your neck, going down into your hand and your arm, that tell all the muscles to do exactly what they need to do to move, to play your notes and play your instrument and play your pieces, which is crazy. Absolutely crazy if you think about it. This whole little nerve bundle right here dictates what our muscles do, all right? And when this gets pissed off, it doesn't make for fun for us. That's for sure, okay? So you get compression of a group of nerves and vascular bundles that they can get compressed in 3 different areas. And I'm not going to go into all 3 different areas where they get compressed, because I've already babbled on for long enough. But again, mind, body, spirit, soul connection is so, so important. All right, what's happening energetically, what's happening structurally, what's happening environmentally that are contributing to injuries in musicians. And the most important thing is that you can prevent things from happening. So I've had people say, well, I've been playing for 50 years, I don't have any symptoms. That's great, but they started when they were 3. So there were somebody's, 47 or whatever, that's great, but that doesn't mean that you're not going to have symptoms at some point in time later on down the road if you're in a really junky position, or if you're not aligned energetically, right? If you're not aligned in what you're doing, if your mindset is an issue, all these different things, they all contribute to what's going on. So we really have to think about, why is the pain there in the first place? So if you're having pain, if you're having symptoms, always ask yourself, what is my body trying to tell me? Years ago, before I started doing my intuitive energy work, I would always be like, okay, I hurt this, so it's this muscle and this nerve. I'd totally be over-analyzing it from an anatomical standpoint. And now I don't even ask that question. I ask, what is my body trying to tell me? What is my subconscious body and mind trying to tell me? What's going on that I'm holding on to, that I need to figure out how to heal and release? And then 99% of the time, my symptoms go away if I heal it. So it's huge. It's so, so, so huge. So types of treatments if you're injured, all right? Biggest thing is posture assessment at and away from your instrument. Have your body fitted to your instrument. Everybody's body is different. Your body is different from your teacher's body. Their neck may be longer, their hands may be bigger, their hands may be smaller. How they play at their instrument is not necessarily the way that you need to be set up at your instrument. So it's really important to have your body fit to your instrument. Activity adaptation. If we're injured, we need to adapt the activities that we're doing. Manual treatment is a big one. Joint mobilization helps, all right? Taping techniques. Respiratory muscle assessment, make sure that we're breathing properly. What position are we sleeping in? Sleeping positions can contribute to our symptoms and make them worse, okay? People who are stomach sleepers or sleep with their arms up over their heads can end up having problems as well. All right. Assessment of any activities that you're doing during the day. All right. There's different types of things that sometimes I'll do ultrasound. I do, I stretch what needs to be stretched. I strengthen what needs to be strengthened. It's a matter of balancing the tissues that need to be balanced. Dynamic stretching and dynamic strengthening. Stress management is key. I do a lot of splinting, making sure that ergonomically you're set up correctly. Joint protection principles, we want to make sure that our joints are in those happy joint positions. I do a lot of nerve gliding. Other types of treatments, it's always, we look at, meditation is really important, I think. Acupuncture is another type of treatment that's out there. Nutrition, there's some things that are inflammatory foods for some people and not for others. It's important to look at those. Massage therapy is a treatment out there that works. The one thing with massage therapy I will say is that if you go once a year or twice a year or even 4 times a year, it's really not going to have a long-term effect on you. All right, it'll feel good and you'll feel good for a few hours afterwards, but after that, it's not going to necessarily hold. Rolfing, some people, that was really popular years ago. It's kind of an aggressive type of treatment. Cranial sacral therapy, I find very, very helpful. I do some of that. It's very much like energy work as well. Osteopathic treatment, Feldenkrais, Alexander technique, body mapping, EGOS therapy, chiropractic. There's so many different options out there for you to use. You just want to make sure that you find what works for you. That's the most important thing, right? And just be really careful with Dr. Google, all right? Google is great. It gives us lots of information, but it can give us the wrong information. And exercises on Google are not one size fits all right? I can tell you that I've had patients do exercises that I got these exercises off of Google, but they actually make the person worse because they're not specific enough to the patient, and they need to, most of the time, I've never had a patient where I haven't had to adapt an exercise to get to exactly what they need, all right? So some of the generic exercises that are out there are good for getting an idea of what needs to be done, but a lot of times you need to modify and adapt it, okay? I think that's it.
Awesome. Thank you so much. That was a wonderful presentation. So informative. And I had a bunch of light bulbs going off when you were talking, like not only for myself, but other things that I had been like wondering about. And I was like, oh, that makes so much sense. And you explained everything so clearly, and it was so thorough. And that was like a crash course in injuries. That was awesome.
I know. I tried to, it was like, I didn't think I had to talk faster. I'm sorry. I went really, really, really over.
No, it was so good, and I honestly want to go back and rewatch this too, and like take notes. I thought it was an amazing presentation. Thank you so much.
Thank you. Yeah, it's a good. I actually pulled a bunch of it from my course and from my other presentations and stuff like that. So a lot of information is in my course, but it's much more detailed.
Yeah. Really quickly, where is your course available for anyone who might be watching and might be interested in participating?
Yeah, so if somebody wants to reach out, I'm doing it more on, I know that you and I had talked about it because I was sort of developing it at the time that you and I were speaking. So it's pretty much done. The first 6 lessons are done. It's 7 total. So yeah, people can reach out to me privately, and I'm kind of doing it privately at this point in time, so.
Great. Well, if you're interested, be sure to contact Heather, and we will include your email address in the comments of this video as well. But thank you so much, and we really hope you're going to join us again in the future. This was a wonderful discussion. And
I went on and on. If people have questions, I can come back in and answer them at some point. So.
Yeah, that would be wonderful. And I'll share the video link with you from the live stream in case you have any questions there. But this time I'll turn it over to Jessica, who's going to close us out.
Yes, well, thanks, Heather. That was really, really helpful, and I found your slides really informative too. So thank you. Yes, and as Francesca mentioned, we keep all of these videos and we make them available to you after the live stream in a number of different places. One is the Puerto Rico Flute Symposium Facebook page. They're all archived there. They're also archived on the Diaz del Moral Foundation website under Wellness Sessions. And then Francesca and I each post them on our websites. Francesca's is playingwithoutpain.com, and mine is mindfulmusicpedagogy.com. So we hope you can access them at any point or share them with people as you see the need. Next week, Francesca and I will be doing a short session on seated positions, talking about that in the context of meditation, but also just in the context of performing. So we hope you can join us at the same time. Thank you.